Robin was 24 when he had his accident in 2008. He was training to be a plumber. Trade for life, my dad said. But his brain injuries were so severe, that went by the by. He can't speak, except with his eyes, and he's completely immobile. Has to have everything done for him. It's quite a list. He has a tube into his stomach for feeding and a tracheotomy for breathing, added to which he's doubly incontinent and his limbs are all rigid. Initially, he was discharged into a young person's nursing home. He was there for about 2 years, but while he was there, he was in and out of hospital with chest infections every 3 months. Then he got MRSA, and we were told he'd have it for the rest of his life. It was then that we got the chance to be part of the personal health budget scheme. Our uncle manages it for Robin and is cared for at home by a group of 8 carers who work on a rota system. When he was in the home, the staff used to rely on us to recognise the symptoms when he was unwell. What with the staff turnover and different shift patterns, there was always a different person caring for him. But now, his carers know him really well and they know when he's not right. And they know when to get us involved. I mean, one of us is never more than 20 minutes drive away. In the home, he had to have suctioning via his tube regularly. We hated that. But now his carers allow him to use his natural cough for longer before intervening. And it's meant that his cough has got a lot stronger. There was an incident in the past where he had to go to hospital due to an infection because the suction tube had been inserted too far. Whereas now the carers, they've been working closely with Robin's physio, so they know how to do everything properly. The only external person that visits regularly is the district nurse to give him his daily injection. His current care team know the symptoms displayed before he vomits, so they know not to give him his medicine then and not all at once, which is what happened in the home. And if Robin is admitted into hospital, his carers go with him so they can alert the hospital staff to his needs and, help with suctioning and attend to his personal care. The quality of life Robin now has in his own home speaks for itself. We make sure someone sees him twice daily. We're all very close and supportive to decide what Robin would have wanted, based on knowing him prior to the accident. Weather permitting, he gets out every day and we always make sure his favourite programmes and channels are on the TV. We even managed to have Christmas dinner with him this year. I could tell by his eyes how much that meant to him. Someone said to me, "Oh yeah, but I bet it costs a bomb." Not really, because we worked out the cost of his care before, including the 8 hospital admissions in those 2 years. Well, there's only been 1 in the last 3 on this new scheme. And he's clear of the MRSA now. But more importantly, all of us, including Robin, despite his life sentence, all have a much better quality of life. And that's got to count.
This patient's story is about the care needs of a young man with brain injuries, told from the perspective of his sister and the experience of herself and her family involved in his care. Her account highlights how a bespoke tailored package of care was set up under the Personal Health Budget Pilot Scheme, which enabled improved consistency, continuity and quality of care that benefited the quality of not only his life, but also that of his family.